Opioids have been regarded for decades as the most effective treatment for pain management. With the global population aging, chronic pain has become more common, and so too has the use of these opioids. However, this more prevalent use of opioids has started to spiral into an epidemic in the United States. The opioid epidemic has hit America in phases. The first phase of increased opioid-related deaths occurred in the early 1990s when pharmaceutical companies tried marketing the perceived safety of their prescription painkiller products. This, in turn, led to physicians prescribing more painkillers, which started getting abused by more patients. The second phase came in the 2000s with the introduction of heroin and synthetic painkillers to the black market. Painkiller seekers looked towards these drugs with the hopes of cheaper, more effective highs, and these combined phases have scientists estimating that now in the United States, around 130 people die from painkiller overdoses daily. But why? It's because they bind with high affinity to one of three different receptor types, mu, kappa, or alpha. Common opioids such as morphine work by acting as full mu agonists by producing their analgesic effects through mu receptor bindings. It is also hypothesized these painkillers activate the brain's reward center, making them even more irresistible.
The opioid addiction crisis is a replay of history. At one point during the 19th century, mothers were dosing both themselves and their children. Soldiers would use opium and morphine to treat diarrhea and painful injuries, and drinkers ease their hangovers with opioids. Physicians would also addict their patients and themselves to opioids because there were few alternatives. The idea to alleviate pain pleased both the doctors and their patients. After this epidemic, physicians were then educated on prescribing opioids, and by 1919, overprescribing opioids was usually seen by older and less competent physicians. Oxycontin, an extended-release form of oxycodone, was introduced in 1995 and is one cause for the sharp rise for opioid use in 1996. The campaign, Pain is the Fifth Final Sign, was launched in 1995 and was meant for healthcare workers to assess and put pain on the same platform as vital signs. The campaign was meant to urge more aggressive use of opioids to treat pain. The campaign was adopted by the Joint Commission and the federally mandated patient satisfaction surveys on pain and are noteworthy for the increased use of opioids in hospitals.
Opiates are considered a group of inhibitory G proteins which can spread throughout the brain, spinal cord, digestive tract, and peripheral neurons. Opiates initiate the release of dopamine in the brain, which cause feelings of pleasure and euphoria. They bind to an opiate receptor on the presynaptic neuron. Once bound, opiates initiate an excess release of neurochemical activity, which signals dopamine into the synaptic cleft. Opiates are also responsible for the enhancement of norepinephrine, which is your fight or flight response. Prescribed drugs such as Prozac, Paxil, Zoloft, oxycodone, and hydrocodone are considered serotonin inhibitors because they block the reuptake of serotonin. They also block the transmission of pain and can suppress the appetite. Short-term side effects of opiate overdose and abuse include pain relief, paranoia, drowsiness, euphoria, and nausea, while long-term effects include nausea, vomiting, dependency, abdominal bloating, constipation, and even liver and brain damage.
The main cause of death from opioid overdose is due to respiratory depression. When overdosed, the victim is given naloxone, which is an antagonist to the drug. In regards to the opioid crisis, there is now more naloxone kits available for first responders. But since this medicine is very potent, the FDA has approved the use of naltrexone, which is less extreme, therefore it can be used for those that have addiction problems. Another problem is the unbearable pain that long-term users experience. Some symptoms include constipation, minute respiratory depression, and inflammation to peripheral organs. Researchers are currently working on designing opioid receptor agonists that enhance the recruitment of G protein signaling pathways, which can increase the therapeutic side effects.
In conclusion, we've seen throughout history the ramifications of the overuse of prescribed opioids. From the early 1900s to the present day, we've seen the rise of their use and the subsequent management of these substances to prevent addiction and death among the population. Along with the introduction of these drugs, campaigns to manage pain have been aggressive in their works to lead physicians to overprescribing. The lack of initial oversight in these campaigns contribute highly to the epidemic we see, but as Sam mentioned, there are studies being done to aid in the therapeutic abilities. If the epidemic is allowed to be continued, it can lead to more deaths in the population, and some individuals call for a treatment of the disease known as addiction from a broadened scope. This is called for despite the understanding that no one treatment is for everyone. In the end, what will be the solution for this opioid epidemic and future epidemics?